We have a really great training for you today with three wonderful, amazing presenters. I'm really happy to bring them here, their expertise and knowledge. And again, this training has been prepared to meet the Mobile Crisis Services benefit requirement as one of the enhanced required trainings. And I'm going to go ahead and welcome our presenters, and I'm going to hand it off to them to do a quick introduction of themselves, and they will take it away.
Hi, everybody. Holly Echohawk here. I'm the Senior Behavioral Health Advisor for Kaufman and Associates. And I want to just start by thanking you for joining this space about culturally responsive crisis care in diverse communities. We know you come to our session today with your own knowledge and your own diversity experiences. I just want to make a note that our goal today is to stimulate thought and perhaps provide some perspective or situations that you may not have experienced before. So with your attendance today, we thank you for joining the space. We recognize that you value diversity and the benefits of inclusive crisis care and crisis mobile response. And we plan to make this presentation or this time together as interactive as possible. So there'll be several opportunities that we'll be asking you to join the discussion. So thanks so much for joining us today. Josh?
Bonjour, and dino amaganadog, kiakis nyakachita indijnakash. So what I said there was hello, all my relatives. My name is Joshua Severance. I'm an enrolled member of the Little Shell Chippewa tribe out of Montana. I currently reside on the Coeur d'Alene Indian Reservation. I am a licensed clinical social worker and an advanced certified alcohol drug counselor, LADAC in California terms. I am a behavioral health SUD advisor for Kaufman and Associates, and I'm happy to share this virtual space with everybody.
And good afternoon or good morning, everyone. My name is Dr. Anitra Warrior, and I'm from the Ponca tribe of Oklahoma, although I reside in Nebraska and provide behavioral health services to our tribes across the state and actually throughout the Midwest region. I am a subject matter expert and behavioral health consultant for Kaufman and Associates. So very happy to be here with you today.
So we're going to talk a little bit today. We're going to overview of what culturally responsive care is, and we're going to also look at it. What does it look like in the mobile crisis response context? We're going to discuss the differences between cultural competence and cultural humility, and we're also going to review the CLAS standards, which stands for the National Culturally and Linguistically Appropriate Service Standards, and how those apply to the care we provide. We're going to talk and go through understanding diversity, and then best practices and skill building, and then encourage and call to action for continuous learning. So I think everybody has started doing this, but if not, we're trying to build a learning community. So please feel free to share your name, your role, your organization, your favorite food. And so our learning objectives today are really to define and understand foundations and principles that drive culturally responsive crisis care. And again, talk about the difference between cultural competence and humility and how that relates to the mobile crisis response aspect. We're going to build knowledge about crisis communication that's responsive, and also some de-escalation techniques and verbal, nonverbal skills. We're going to deepen the knowledge about intersectionality and how that looks in the crisis setting. And we're also going to go through applying the no wrong door approach, which is different than the Medi-Cal, Cal-AIM standard and policy. The no wrong door approach is SAMHSA best practice for providing an open continuum of best practice crisis care. And again, we're going to look at crisis communication techniques and do some applied learning.
So we'll start off by kind of reintroducing ourselves to the diversity that we see across California's community. So we're going to spend some time looking at some current demographics. We'll go through the data that we see, and then we'll also do a walkthrough on how to access some of the websites to gather more information about your county or about the state in general. And neighboring states as well, but where you can access more detail about populations that are being served. So before we do that, let's go ahead and have everyone, if you have a chance, to go ahead and share in the chat ways in which you've seen diversity across your communities and in your workplace. And we'll read some of those off because when we think about diversity, it's a very, very broad term. And sometimes it could be limited in terms of how we think about it, that it may be specific to race and ethnicity, but there are many ways in which we experience diversity. So we just want to tap into that collective wisdom of the group that's here and highlight some of those ways in which we experience diversity in our communities. So I don't know if it would be good for me to go ahead and read some of these off, but I do want to highlight food because I appreciate you sharing the diversity in the food, in the cuisine that can be phenomenal. So thank you for highlighting that. And absolutely with the culture, the dynamics, the religion, and what I want us to keep in mind, and we'll spend more time on this a little bit later, but what I want us to keep in mind are ways in which we experience this diversity at multiple fronts, meaning I may have this religious perspective or I follow this religion. I also identify as this type of person, or this is another way that I identify my role in my family. And there's what we call intersectionality. So we're going to talk about that a bit more later, but just wanted to be able to really tap in and kind of get our mindset in terms of we are going to be focusing on diversity. So thank you very much. These are really good ways that you're experiencing it. So cultural, economical, sexuality, yes, all of these, including language. Language is huge. And we'll also tap into that when we talk about how we're expressing ourselves, our verbal and nonverbal cues as well. Okay. What we will cover today will be some of the ethnic, racial, LGBTQI+ and Indigenous communities differences that we're seeing. We're going to talk about the importance of mobile crisis services. But what we know is that California is essentially global in terms of the diversity and what's represented in the state, in the very large state. What's also important for us to keep in mind is how it's continuously evolving. That's important. And that's going to go into how we need to continue learning to support those communities that we're serving. So we want to be able to recognize the diversity, the different types of diversity in our population, the languages, the communication styles, because all of this will have a direct impact on our response, on our crisis response intervention services. So I get the pleasure of reading some stats for you. Let me move this chat box very quickly. And I'm just going to go ahead and read these directly because sometimes it can be difficult to see when we're presenting numbers and just how we can actually visualize what's here. So I'm going to go ahead and read these directly. So California is a majority minority state where non-Hispanic whites make up less than 50% of the population. The Latinx population is notably large and continues to grow, with particular concentrations in cities like Los Angeles and Riverside. 27% of Californians are foreign-born, with a median age of 37.6 and a half of those 24 years and half of those are 24 years and younger, and they are Latino. California also has significant Asian American and Pacific Islander communities, each with their own unique cultural and healthcare needs. About 9.1% of California's population identifies as LGBTQIA+, with large communities in cities like San Francisco and Los Angeles. We also, within California, have 109 federally recognized tribes and 10 urban Indian centers.
With all of the diversity and the communities we have, we also have a disproportionate impact on those communities. The marginalized communities. In California, Black residents are 3 times more likely to be victims of fatal police shootings during the mental health crises. And from the period of the last few years, from 2017 to 2021, we looked at fatal drug overdoses or poisonings that increased by 208% among Blacks, 201% among Hispanics, and 150% among Native Americans. It's just very disproportionate impact of all of these health disparities. And so I've listed here how to access your local data, because it's important because of the rich diversity in California, and we see different cultures and different people, like communities, develop in certain places. It's important, especially for counties, to look at what's going on in their community. And so there are links, and everyone, to my understanding, will get copies of slides here, and they can access local, state, and fast facts data using these links. And so the last one, the California Department of Public Health, looks at county health, and those are social determinants of health, things like drug overdoses, fatalities, shootings, and things like that. I think it's important to review.
So nothing changes unless someone is made to feel uncomfortable. This quote is by Dr. Frank Lemire from the Winnebago tribe of Nebraska. And Dr. Lemire has spent several years, addressing disparities in health, politics, many different things that he had done for communities. And through his work, this was something that he would share with communities, with policymakers, with healthcare providers, that nothing changes unless someone is made to feel uncomfortable. With that discomfort, it can be really challenging for us to engage in change, to impact change. And when we have systems that are providing quality care, being able to adapt those to the diverse populations that we have can make it really difficult. And sometimes it can be very uncomfortable for us. That's not only through the systems, but even for our work individually. With that being said, that can contribute to resistance when we're talking about culturally responsive care. And with this, when it comes to thinking about that, what we want to recognize is that conflict is actually change that's trying to happen. And this is going to come from C4 Innovations. You'll have a link to them as well. Thinking about that conflict is change. So with Dr. Lemire's statement, as well as the resistance, understanding that this process is not easy. This process will include mistakes from us all, but it's a learning process. We don't actually ever arrive in saying that I'm fully competent in this culture. I'm fully competent in this area. And with that and the level of work that goes into this, it can create that resistance, especially when we talk about the fear of the unknown. So as we progress through our presentation today, we'll talk about the different types of practices, so best practices that are going to be available. We'll also talk about how to implement culturally responsive strategies to lead to better patient outcomes. And that's going to be, of course, what we want to see in the work that we're providing. So as I talked about how difficult this could be, I'm going to read this slide with implicit bias. So the role of implicit bias. Implicit bias is defined as a negative attitude of which one is not consciously aware against a specific social group. We're not consciously aware when it comes to implicit bias. There is an impact on patient engagement and service delivery when we have that implicit bias. And it doesn't allow for us to experience cultural humility as we're providing services. And we'll talk a little bit more about cultural humility in further slides. As we tap into implicit bias, this can come from our limited access to other groups. And what happens is unconsciously we're pulling in knowledge, whether it be from stereotypes, things we've seen on TV, but we're going to formulate these ideas unconsciously on what this person may be experiencing, how this person may identify themselves, what we can almost predict of their behavior, that can all come from implicit bias. And without doing that self-reflection of ourselves to recognize when this is interfering with our decision making, this can really have a negative impact on the way services are delivered and the interaction, and therefore impact the outcome of the actual service intervention itself. So with that, we'll go a little bit more into cultural competence versus cultural humility. So I've already kind of tapped into that just in terms of we don't ever reach full cultural competence to say I'm fully competent in this area. There is merit behind this term, though, and that's something that I do want to quickly highlight, because when we think about cultural competence, another way to consider that term is having the skills to go and learn more about this, having the skills to do additional research. That's going to be a way in which I can be competent in learning about other cultures. What does that engagement look like? And so with the overall definition, though, of cultural competence is, let's see, it's been described as a set of skills or a level of knowledge about various cultures. However, it subtly implies an endpoint, which we've talked about already in terms of, okay, I've arrived with this level of knowledge. Doesn't actually happen, so it can be misleading. Now, when we talk about cultural humility, this is going to embody a lifelong commitment to learning. The other piece that I want to highlight with this is that it also changes the power dynamics when we're talking about humility. When we have that, when we come in without a level of humility, there is almost a framework of superiority in this is how things are supposed to operate. This is how I know things to work. And so my way is going to be the preferred way. That's not how we're going to be able to support the individual in being culturally responsive, because there's that power dynamic in terms of what our worldviews are, what our understandings are. So it's important for us to, which can be uncomfortable, really look at that implicit bias, but also incorporate cultural humility, which is going to mean we have to continuously do that self-reflection. We have to continuously engage in our own awareness and how how we're personally interacting with people. We want to be able to gain an understanding of their religion, their beliefs, their foods even, and to really understand the cultural underpinnings of who they are as individuals. So what is most important to me in this piece is how cultural humility removes that power dynamic. There is no level of superiority in the manner in which we provide services.
Great. And going off of that, being aware of how we present. So until I introduce myself in my native tongue and share that my culture, people don't notice me. They don't recognize that, oh, he's Native American. I'm an enrolled tribal member. And so I really like the comment that Michelle Johnson, you put in the chat. You can't assume someone's identity. We are multi-sectional in the way that we experience. So ask the expert, the person themselves. It's exactly right. You ask the person, and being aware of how that power dynamic may come across. For me, I'm a 6'4.5", 220-pound guy. And so when I was running calls and I was in mobile crisis response, I would always ask for permission to enter that space of somebody. And it's such a sacred thing to be able to provide care when they are in a vulnerable spot. And so recognizing that I have a pretty big stature and I don't want to come across as aggressive, and I always ask for permission to enter that space. So just being aware of adapting those types of styles. Like communication is more than just the words we speak. It's also adapting how we communicate with our body, how we communicate, in the context of, okay, I'm maybe a fair-skinned Native person and I'm in this situation. Let's find the experts. Let's find the connections to help us learn about it. So an example of an inclusive mobile crisis response model is there are certain ones that are used like situational crisis, coordinated management. When I was a firefighter, we used the ICS, Incident Command System. It's very sterile and there's not a lot of room for culture to be included. However, the cross-cultural communication theory, which was developed by one of Holly Echohawk's friends, Terry Cross, and it was built upon about cultural competence. And that's exactly what we're talking about, is the expert is the person that you're talking with. And it varies from person to person. So let's avoid generalizations and just get to know, let's get to those connections. So.
Those are great examples, Josh. And I forgot, and I love the example of you, the way you describe yourself as a fair-skinned Native person. And I forgot to mention in my introduction that I'm a member of the Pawnee Nation of Oklahoma. And the way I look, and with a last name like Echohawk, I mean, it's a pretty safe assumption that I'm a Native person. But that's not always the case, as you all know, in the people listening to us around the state. I also wanted to mention that I lived in California for 26 years. So I lived in, and the reason I'm bringing that up is because of diversity. I love California. I loved living there. I loved hearing Spanish language on the radios. I love the diversity of San Diego, the surfer side, and then the tribal side over in the East County, North County, San Diego, and Sacramento, San Francisco, Oakland, Humboldt County, all places that I lived. And I loved all of the diversity of all kinds of people, all kinds of languages, all kinds of appearances, all kinds of beliefs. But the most important thing, before I talk about class for a minute, is I often talk about leveling the playing field of the role of expert, that the people that we serve who are in great distress, at the worst moment of their lives often, their community, their family, and they themselves have a lot of expertise. It may be hidden by their distress, but they have tremendous expertise on resources, on survival, on wellness, what gets them back in balance. So leveling the playing field in the role of expert is really an important fundamental principle of equity and cultural responsiveness, all of which you all listening to us know and have examples perhaps of, and even examples of how you learn that, maybe in not the easiest way. So we just wanted to touch base on the CLAS standards, the National Culturally and Linguistically Appropriate Services Standards, developed through the Office of Minority Health. There's a link there that you could review them. The CLAS standards are really important. They're designed to help all of us deliver services that are culturally and linguistically appropriate, of course. So that's obviously very critical, but it also, underlying all of those principles is respect, that we, in the work that we do, have to have respect for the differences and learn to be comfortable with differences. The other underlying purpose of the CLAS standards is to help improve quality of services that we provide. One approach, of course, doesn't always work well for all populations. That's obvious. One of the things that Josh and I have worked on is taking some basic screening questions and for tribal populations to indigenize how you would say that those same basic conventional questions in a native way to a native person. And just by tailoring, in that this is a specific tribal example, but there's many other kinds of examples, but tailoring the standard approach to the population that, or the person's diversity that you're engaging with, will elicit many things. Increased trust from the patient, deeper conversation, and more insight into where they're at the moment, what they're feeling, how they got there. But just a few bits of tailoring and talking in a way, whether it's volume of voice or pace of conversation, all of that is tremendously important. And we see the effects, the positive effects that come out of that. So the CLAS standards are 15, list 15 action steps that can help improve services. It's a good tune-up, I call it. It's a good thing to look at them once in a while, just as a tune-up, just as a reminder, both for your organization and for the direct service work that we do in crisis care that you all provide. So there's a link to the CLAS standards. It's a framework. They're broadly written, but it is a good tune-up to take a peek at them again if you haven't looked at them in a while. The next slide. Implications for mobile crisis response. So we use two photos here that are very familiar to many of you on the call. Central Valley, of course, on the left. Really fabulous place. I can't tell you what joy it brings to me to hear and be around Spanish-speaking people, whether they're Guatemalan, Mexican Americans, Central American people. It really brings me a lot of joy. I love hearing different languages. And we all know that. We hear that a lot in Central Valley. The other picture is San Francisco, the Tenderloin District. I lived in San Francisco during the Moscone murders and George Moscone and Harvey Milk, and was very much a friend to the gay community. So I've seen in all the years, and many of you, if you're from the Bay Area, have seen all of the trials and tribulations of San Francisco City and County, and the changes in districts around the city, including the Tenderloin District. Great, incredible diversity in San Francisco. So there's many implications of everything we've talked about so far for the work in mobile crisis response and crisis care. And we've talked about understanding the contextual environment. One of the things that we're going to talk about next week in a different session, specifically on tribal, is the historical and political context of that's important to be understanding of with tribal populations. We also talked about the ethical and underpinning and how our constant attention to diversity and respect for differences results in more effective interventions. We mentioned before about the true no wrong door approach, and we mean the approach, the no wrong door approach, which is basically anywhere, anyone, anywhere, anytime. That you all in your counties are, fantastic responders to people in need. Anyone, anywhere, anytime, any culture, any language, you're there. So just providing a few examples about diversity and implications for your county's work in mobile crisis response. So let's move on to the next slide.
Thank you, Holly. And as Holly had touched on, with thinking about what ethics go into this is an ethical responsibility of each of us to understand that in service provision. So with ethical considerations, we want to keep in mind an ethical decision-making model that can actually guide us and help us determine what our best steps are going to be, and also will lead to more consultation. And when we have a higher level of consultation or even the peer-to-peer support, we're going to move more into critical thinking styles and really questioning our behavior, so we can step outside of what is unconsciously happening for us and get that additional feedback to support what we're doing. This is a part of why it's really important for us to consider ethical decision-making models. In the references that you'll have with this PowerPoint, there is a link to an actual decision-making model for this. And I do highly recommend documenting each of those each of those steps in that decision-making model to really give you that time to reflect and take that personal in terms of how I'm removing this implicit bias, how I'm continuously doing the work to improve these areas. Other ethical considerations include data collection and then continuous improvement. Now, data collection is one that I would say, has a long history. And when we think about ethics and the challenge that we've had with ethics over the years, the various types of studies that have been done in the name of science and to understand human behavior and how to respond, and then how to improve programming. The data collection is, there's that fine line of learning, but also being intrusive to where we're invading someone's space. And what's the actual value of the data that we're collecting? Is it serving us, or is it actually serving that individual or that community? And then how are we using the data, but also how are we gathering it? When is the right time? When is the ideal time? Who are we partnering with to be able to gather this data in an accessible manner that's respectful to the communities that it should be going back to serve? So there's really important components for us to keep in mind when it comes to ethics and data collection. And again, how we're gathering that information, what we're doing with the information that we're using, and who is it actually benefiting. The other piece for us to keep in mind is the continuous improvement that goes along with this. So all of this is crucial in the work that we do in our crisis response centers. This is very important for us. But it's something that we have to continuously monitor in terms of what are the shifts we're making. So Josh provided some links to multiple websites that you'll be able to access from the PowerPoint. We do encourage you to do that. And I don't want to go too far off script, but I do want to encourage all of you, because as we've talked about the collective wisdom within this group, we have, these sites that have been provided to learn more about your community. I also encourage you to share various websites or resources that you've utilized to gather more information about your community, and feel free to share that in the chat. So as a community who is providing services, we can see this information. We can learn from one another. We're a community together serving. That's also going to be a part of continuous improvement. That's continuous improvement in action in this presentation. We're looking at how are we gathering information? Where is the data coming from? So I think that would be really helpful for our community members within this area to find out, okay, where are we getting our data from? How dated is it? Do we need to make some updates to the data that's here? Because am I actually serving the right people? Am I putting the right information out? So that's where the ethical piece will come into how we're doing that continuous improvement for those that we're serving. So now let's talk about intersectionality. I think this one is so cool. I think that's the best way that I could say it. It's just so cool. So I'm going to go ahead and read these slides again, because, we have the smaller text here. So it's been defined as a theoretical framework that investigates how interlocking systems of power and oppression at the societal level influence the lived experiences of historically and socially marginalized groups. Also, that our mental health does not exist in isolation from above identity markers. Intersectional approaches help us to understand the differentiated nature of vulnerability and resilience. They also draw attention to the social root causes of vulnerability, creating a more nuanced picture to uncover dynamics that can shape vulnerability and resistance. So, what does this mean to us as crisis responders? It can mean a lot. It definitely means a lot to us, because I don't want to go into a situation risking that implicit bias that can happen unconsciously, what we've already talked about, and only locking in on the mental health issue or the substance abuse issue without actually knowing who am I going in to serve? What are going to be some ways in which there is that intersectionality of who the person is, who the community is as well. So we think about this at the individual level. It's important for us to think about this at the community level as well. And where are identities intersecting? Who are these parts of these individuals, of these communities, and how does that inform service provision? How does that inform my approach to this individual? How does this inform my approach to the community? Like Josh had shared, with his identity and his physical stature, he's going to change his approach because he's going to do what's going to be safest for those individuals. That all of that comes into intersectionality and how we define ourselves. Now, when we're talking about the diagnosis component, this is also important for us to keep in mind. A friend of mine, a very dear colleague that I recently spoke with, she's an African-American psychologist, female. And one of the things that she shared was she was not going to take a job that she felt very strongly about. She wanted the job, felt comfortable, had actually accepted the position, and God had spoke to her and told her this was not the position for her. In our conversation, it was important for her to be able to share that, thank you for not judging me. Thank you for not thinking I was hallucinating when I'm saying that my spirituality comes first as a Black woman. I hear God speak to me. That is not psychosis. That is how strong my spirituality is. That's another level of intersectionality that we have to keep in mind. Had I not had an understanding of that, had I been strictly clinical, strictly like DSM diagnosis, I'd be thinking psychosis. So these are things that are really important for us to keep in mind as we're understanding those that we're serving and that intersectionality, and being able to remove that implicit bias that again is there unconsciously, continuing to do that self-awareness.
Oh, I'm going to touch base on a couple of examples of one, and I'll do this really briefly so we leave plenty of time for questions and answers and conversation with you all. The Department of Healthcare Services has supported the California TMAT project, which is fantastic. And if you go to the next slide, the Tribal Medication Assisted Treatment Project. There are 30 tribal locations, urban Indian, across the state, who are part of this network. And I just want to focus on a couple of the highlights of this and lessons learned and pertinent information for mobile crisis response. So in this big community collaboration, it very much underscores the importance of Native community leadership being in the driver's seat of the development of those services. So that's back to what I mentioned before, leveling the playing field on the role of expert. And so because they are leading the charge, so to speak, the strategies, the approaches they use, the way they engage Native patients are all culturally sensitive, community approved, and locally meaningful. What happens in one community may not work in another community. So I'm going to skip down to the lessons learned. There are many lessons learned in this, and this network has been developing for about 5 years now. One is we see the wealth of tribal knowledge, their innate intelligence as strategic thinkers, and the very vast knowledge of networks that they have at their fingertips to lead to, again, locally meaningful support for their patients that are trying to recover from substance use treatment. The other lessons learned that I want to share with you all is the big challenge, trying to take tribal approaches in conventional healthcare services. That marriage is not always an easy marriage. And we see that, all of us on the call, we see that all the time when the standards that we operate off of, including DSM on the mental health side, were not designed for diverse communities. So healthcare systems and licensing accreditation is not designed for the minority underserved population. So marrying those two systems is an ongoing challenge, and that's a big lessons learned out of this project. But pertinent to you all in mobile crisis care world is obviously there's many lessons in cultural competency, integrated care, many examples of what works and how they made it work in marrying those different systems, and of course community engagement. So hopefully we'll share another time with you more about this work, but there's many implications, and even though it's tribal specific, the diversity crossovers and the lessons learned can apply to many other kinds of populations as well. So the next slide. Thank you.
Another great example of the concept of intersectionality, when we looked at tribal TMAT, the medication assisted, that's two cultures right there. You're looking at Native American and you're looking at those who are being treated by medication assistance. And how those intersect and what that looks like creates another layer of culture that we have to be mindful of. And that program is amazing. Just as the Trevor Project was started in 1998 right there in West Hollywood. And it came actually from a drama that was done in a production, and there was an aha moment by the founders. And they said, there's this huge need for LGBTQ support, for crisis, for young people. And so the Trevor Project just existing, it shows the need for intersectional services. And the group of young people who will also identify in the LGBTQ community, that's the intersection there. And then if you add another racial identity, certain demographics, those are different intersections of where people are at. And so the Trevor Project, phenomenal work. I mean, it's the national leading, I think it's one of the world leading crisis and suicide prevention services offered for young people and for LGBTQ people. And I'm definitely an ally. And so I like to hype them up as much as I can. And so some of their implications, some of the things that were learned here. So they have a 24/7 hotline access that, and even their website, if you go onto it and you hit escape 3 times because people maybe who aren't ready to make that step in their culture and in their identity, you know, just those subtle nuances of including those things is a great example of intersectional excellency. So of course, being culturally responsive, a lot of the hotline workers, absolutely allies, and then also people from that community provide that support. So there's meaningful connection. There's, you know, stewardship there where people are taking care of their community. And just as we offer mobile crisis response and we go to the person and provide care, the same sort of format, and it goes in with the anyone, anywhere, anytime approach of offering these types of services. And so going from something like that into how do we apply it? How do we use this information of intersectionality and these cultural responsiveness into practical skills that will be meaningful for us? I gave that example of me being aware of my own stature, my own physical appearance, and what that might bring up, and then how I'm feeling. That's very important to know. How are we feeling about the situation? And so Dr. Warrior is going to talk about some clinical skills here that can be applied.
Yes, thank you, Josh. So let's talk about mindfulness for just a minute. So it is imperative, not an option. It's associated with calming, meditation, yoga. There's a lot that is associated when we talk about mindfulness and the benefits of mindfulness. What I would want us to think about in this is really being present in the work that we're doing. When we experience these situations, these high stress situations, or these traumas, we don't know history about people to where what may be triggered. And that's not just for those that we're serving, that's also going to be for ourselves as the respondent, as the crisis responders. So it's important for us to think about this impacting me? How am I going to be making my decisions? So I think everyone could possibly see me in the photo or the video piece. So I'm going to show something that like this. So this is kind of like what our brain would look like physically. A way that I describe this is thinking about, so not so much the left and right side of the brain, but the front part of our brain up here, which is where our executive functioning happens, and the back side of our brain, which is where our emotions and memories are going to be. In the front side, with the executive function, it's going to control those impulses, it's going to control those memories, those emotions. And the way that I explain this to people sometimes when we're talking about mindfulness is that if we're triggered, rather than going through kind of that fight, flight, freeze, fawn piece, I talk about in a different way. And so thinking about, again, the front part of our brain that makes the decisions, controls impulses, the back part of our brain with the emotions and the memories that come up. When we get triggered or we're in a crisis situation, sometimes what can happen is it's like the memories take over. So now I'm clouded by my emotions, by my memories. And what mindfulness can do is help pull that back for us so we can think clearly with our executive functioning part of our brain. That's why mindfulness can be, so that's one of the many reasons why mindfulness can be so important for us in our decision-making models, in the way that we provide services. Another piece to this with the mindfulness is the somatic attunement. And what that's going to be referencing is where our bodies are, what we're experiencing with our bodies. And with that, we wanted to practice just very briefly. We won't go more than a minute on this, but we wanted to do a grounding skill. So 5, 4, 3, 2, 1, or maybe some of you have heard of it as take 5. But what it's doing is allowing us to be present. It's going to be another major piece of mindfulness, being present. Because if I get into a situation as a crisis responder, but I'm thinking about all these things, all these steps that need to happen and everything that's going on and what happened last time when I had experienced something similar, that's going to cloud my judgment. So I need to be able to focus on where I am in this moment at this time. So I'm going to ask everyone, we won't take more than a minute, but I'm going to ask everyone to just sit back, find a comfortable position, and allow yourself to start taking some deep breaths. What I want to encourage you with the deep breaths is to really focus on breathing in through your nose and into your belly. This is called diaphragmatic breathing. In through your nose, out through your mouth. Focus on this going into your belly. This will actually slow your heart rate. And as you're doing that, I want you to think of 5 things that you can see where you are. 5 things that you see. Continue to breathe as you're pointing these out. And allow your body to be present. Now let's move to 4 things that you feel, not with our emotions, that we can physically feel. You can feel your glasses on your face, the softness of your clothes, the pressure of your shoes. Continue to breathe. Now let's focus on 3 things that we hear. The sound of my voice, the sound of the air conditioner, the sound of silence. Continue to breathe. Now 2 things that you smell. This can be your hair, your clothes, air freshener. 2 things that you smell. 1 thing that you taste. Okay. Now what we did was blocked out kind of, other than hearing my voice, what we blocked out was all of this input that was coming to us. We blocked out the future, we blocked out the past. We were completely present in that moment with what we were actually experiencing. That, along with the breathing, can be very powerful in calming ourselves and helping us move forward with decisions. And I apologize. I had given a warning to Holly that sometimes I talk a little bit too much. So I'm gonna speed it up just a little bit here. Okay, so now that we have, a skill that we're able to use, let's talk about some other things that we might experience in situations. So the next two slides are gonna be about nonverbal and verbal cues. And in this time, after we wrap up with these two slides, we're gonna move into really sharing and tapping into that collective wisdom again from the audience, from all of the participants. So we'll want you to share in the chat again. Now, as we think about nonverbal cues, it's important in diverse populations. There's not one specific way that we have to communicate. What I have to share about this is that within systems, there can be an expectation of what professionalism is, how we're supposed to dress, how we're supposed to speak. And this is a measurement of what means functional. This is a measurement that doesn't apply across all standards. So it's very important for us to keep this in mind in diverse populations. When we're navigating nonverbal cues, we want to think about limitations of existing crisis communication theories, which can go back to what I had just mentioned. And some examples of nonverbal cues that we're going to see would be eye contact, gestures that we have. This could mean how we're talking to someone. So you can see my hands moving. That can actually be threatening to someone as we're talking with them. The other gestures could be our facial gestures. There can be a lot of judgment behind how we roll our eyes, we scrunch our eyebrows. So those facial gestures can also mean a lot when we're communicating with people. It can also suggest confrontation depending on how we're looking at someone. Our posture, which can also lead to that level of confrontation as we're working with individuals. And when we're talking about a crisis situation and thinking about where the brain is it fight, flight, freeze, fawn? And then we're posturing and coming in that sense of power. Yeah, we're gonna change the dynamic of what service is going to look like and how we're able to help them. Posture is very important. Personal space. This is also one that's very important, because are we going to invade that space of that person who, whatever way that they may have been traumatized, are we going to re-traumatize them because we don't understand nonverbal cues and we're invading that personal space that maybe they've lost, that through the trauma or through these crises that they've experienced, that's a challenging thing for them with the personal space. These are all ways for us to navigate nonverbal cues. Then let's talk about our verbal cues. So this is going to be part of active listening, is going to be huge in that. And when I go ahead and ask people to start putting this in the chat, so just moving ahead a little bit more, share in the chat ways in which you've seen active listening. How do you know someone is listening to you? Let's go ahead and share those in the chat, and then I'll read through those as we continue to go through this. The other piece that I think is so important for us to recognize is the appreciation of silence. So, how many of you can feel comfortable with silence? That was a test. I was being silent on purpose. So did I make this? Anyone feel uncomfortable? Sometimes it happens. And what can happen when we're doing that is we have this rush to fill that space so there isn't the silence. Think about that. Is that for me or is that for them? Now, when we're talking about differences in culture, sometimes there are those pauses, depending on which group you're working with, to where we need that time to process. We need that time to be present with what that experience is. So I don't have to rush in to share. I don't have to rush in to problem solve. I have to rush in to listen, to be present, to hear what that silence is saying, to understand what that silence can mean. That's so powerful for us, because when you don't recognize that, sometimes it can be that implicit bias that comes in. It can be that lack of cultural humility that can creep into where now there's this power dynamic, the superiority of we need to be talking, I need to be getting these solutions done, without actually hearing what is going on, what is being shared. So I had to spend a little bit of extra time on understanding that appreciation of silence and how powerful and impactful that one can be. We also want to consider open-ended questions. And, thinking about when it's a yes, no, what are we guiding that with what we're asking? How much of that is coming from us? And sometimes we just have to ask yes, no questions. There's value behind that. So we don't want to not have those, but to really do further exploration, we want to try and move forward with more of the open-ended questions to invite them to share from their perspective, not our understanding, from their perspective. Then we also have non-English speaking or English as an additional language nuances that we want to take into account. This is going to be really important as we're understanding what happened, what took place, what was misunderstood, what do we need to know so we can interpret what has taken place and the best way to serve those individuals. Now I'm going to turn it over to Holly to talk about deaf or hard of hearing cultures. And as she's doing that, I do want us to still take some time to really reflect on, how do I see this impacting my work? Mm-hmm. In what ways do I see this happening? And that might be a lot to share in the chat. So I would encourage you to go ahead and raise your hand if someone would be interested in sharing, and just open that up to what these experiences have been like. So Holly, I'll go ahead and turn it over to you, and we can start looking through the chat as well. Thank you.
And in recognition of the time, I'm going to do this really quickly, but I did have experience, and many of you may have as well, in working with deaf and hard of hearing people with the State School for Deaf in Washington State. And I learned so much about diversity and cultural responsiveness when you take race and color out of the situation. I learned a tremendous amount. Patience was really important. As a non-signing person myself, relying on translators, really got incredible insight into the multiple cultures within the deaf community. There was great controversy about or segments of the population, I suppose, about support for in-ear hearing implants or not. Some people that were our mental health person that we hired, it was the only deaf mental MSW in Australia, the entire country. He was third generation deaf on both sides of his family. They had zero interest in ear hearing implants. Why would they want to change who they are? They're deaf people, deaf strong. So there's tremendous pieces about all of that were great learning for me. But primarily it is open understanding of the way people communicate, how they applaud, how they end meetings, their speaking ability or not, and understanding all the different subcultures within the deaf community. So I'll just leave it at that and we'll go on.
This is for the participants. This is for y'all to respond to and just think about. So Aisha is a 27-year-old Native American woman who has been previously diagnosed with generalized anxiety disorder. She also has a history of traumatic experiences, and she uses traditional indigenous healing practices alongside her psychotropic medication. Alex, who is a mobile crisis responder, he's dispatched to the park where Aisha is in emotional distress. Aisha is visibly pacing and talking to herself. Alex, unaware of cultural nuances, approaches Aisha directly, makes eye contact, and says, "Hey there, I'm Alex. I'm just here to help. Can you tell me what's wrong?" Aisha becomes more agitated. She avoids eye contact and appears on the verge of a panic attack. So some things to consider just go ahead and answer in the chat. What elements of cultural responsiveness could Alex have employed to better connect with Aisha? And considering her background, being Native American is not always an ethnic, it is infused, but it's also a political identity. How could that have influenced the presence of a generalized diagnosis? How can crisis responders be mindful of the intersectional aspects of her identity related to that? So Jose, request permission to engage. Yeah, that's a great go-to. That was mine. The culture of learning and expertise is in all of us. And Indino means we're all related. We all share a common knowledge. I see somebody put in the chat a Maori statement that means very similar, like we're all connected and we all have this. So great. Good, Claudia. Yeah, how does Alex know she's Native American? And maybe that could be inferred by dispatch. And then also, maybe a good question. Cultural consideration of him being male and her female. Excellent. How might a culturally responsive assessment differ from a standard one? Talking to self, great. Ask for their name. These are all excellent examples. Yeah, he could have adopted a non-confrontational approach, respecting the distance and avoiding direct eye contact, using a softer tone of voice, not being so blunt. And a lot of, when I worked as an EMS captain, and I often said that the best intervention you can do is before the ambulance fires up, meaning before the tones drop, you go out in the community, you get to know who it is you're serving. And so getting to know and getting educated, coming to talks like this, interacting with others, that's all excellent examples. So thank you everybody for your responses. Excellent. Turn it over to Holly to talk about best practices.
Oh, just some quick tips on best practices for cultural responsiveness. We've already been talking about respecting every person's individual experiences, and job well done, everybody, on your comments in the chat. Recruit diverse staff in your organization. That doesn't mean one, and it doesn't mean someone with no authority, no decision-making authority. Some of the best practices are, if you have 20, this is where your data comes in. I'm just making this up, but let's say you have 20% Latino population in your county. 20% of the staff should be Latino or higher, depending on the morbidity, mortality of that population. So hiring one person is a start, but that's not the end. Multiple people, diverse staff, and not just in race and color, of course, all the ways of the meanings of diversity. Partnering with the community is incredibly important. We did some work with the California Bridge Project, the emergency hospitals in the state, and they learned the great value of being partners in the community, going out to the community, making those connections, incredibly important. And of course, we just talked about listening and learning, all of which you all clearly know much about it through your chats. So Terry Krause, my friend and colleague for many, many decades, did some of the early work in the field of cultural competence with some other colleagues of ours around the country. And one thing he always said that I just really appreciated is that cultural competence is not a problem to be solved. Rather, it's an asset. And in mobile crisis care, it's an asset to de-escalation and stabilization. So I love the way that he framed that. So we wanted to share that with you. And then the next slide. The importance of providing culturally responsive care, especially in the challenging work that you all are doing in mobile crisis care. And I saw in the chat, someone had mentioned that, when you don't know, you're responding, you don't know what the background is of that person. You have no time It's not as if you can spend, a long time, trying to get to know somebody. So we totally understand that. But being as culturally responsive as possible, even in your tone and how you approach someone, asking for permission, all of those pieces that we've talked about and you have in the chat, dramatically can improve the kindness and humanity and clarity of your interactions with the patient that's in great distress. So I think all of this is just important, but you can see it on the screen. So we'll go on to the next slide. So resources for continuous learning. The California Reducing Disparities Project, which some of you may be familiar with. I know that 44 counties are working very closely with them and have been for the last year. So yay for that. Incredible resource. Think Cultural Health is something that I worked on with the Office of Minority Health when we developed this several years back. And there's, if you go to that website, there's self-paced learning for different categories of professional categories, including emergency. Great resource. The National Network for the Elimination of Disparities is sponsored by SAMHSA. They refer to it as NED. And of course, the Georgetown University National Center for Cultural Competence, and they have a series of self-assessment tools there as well. So just some quick resources, and you have your own resources, I'm sure, which we would love to hear about in the chat if you have other resources.
I always think this is interesting, and what we learned today versus what I can talk about what I learned, but I really want to hear maybe in the chat what everybody learned about these sorts of things. And then also I really appreciated everybody's feedback and responses, because it just builds a community of us who are caring for others. And so excellent work. We talked about the foundations of cultural responsive care, the intersectionality, about those multiple cultural identities. We learned some clinical skills for verbal, nonverbal communication, and we learned about best practices from a clinical and a programmatic standpoint, and some resources for continuous learning. So with that being said, let's open it up to questions and discussion, engagement.
I wanted to just thank Holly, Josh, and Dr. Warrior for such a wonderful presentation and all the expertise you brought today, and also to everyone in the audience, all of the participants, and all the knowledge and expertise you're sharing in the chat. There are a few examples. Juliet Forbes, you're giving some really great best practices around just acknowledging, like, I'm here because of this, but I really want to hear from you, and I want to hear your story, and I want to know how I can help you. That is such a person-centered approach, and I'm just wondering if you could share a little bit more with the rest of the group. Really appreciate your insight and obviously your experience.
No, I just think that, right, sometimes folks do call for themselves, but oftentimes it's law enforcement, or it's a parent, or it's a school, or some other community partner. And sometimes they're aware we're coming in, sometimes they're not. But regardless, when we show up, I think just showing them that they have power in that space, and that we really are there to support them and focus on them, is the biggest piece. I'll be honest and say, right, like, hey, I'll listen to your mom, or I'm going to listen to the collateral of the folks who are trying to support you. But at the end of the day, what you're telling me matters, because I think sometimes they lose that power and they feel like decisions are already being made based on what everyone else around them is saying.
Thank you. Yeah. I mean, and then like what you said, it can feel jarring, like, or just like stay like numbing, that they're like, I don't understand why someone called, or, because they may not just be in that state of mind to see or understand what's happening and why. And so I think I really appreciate your approach and what you shared. Same thing with John Rodriguez. You mentioned in the chat just that very person-centered approach, like being very direct about the reason why you're there, and really giving them the opportunity to share what they need. Anyone else have any additional strategies or best practices to add?
In my experience, especially coming in, Joshua, I super appreciate your sentiments at the beginning. I mean, I'm 6 feet, I'm a large guy. When I come in and talk with someone, it can be intimidating. And so I do my best to explain the process, explain why I'm there, explain the dynamics and kind of be open about that. I think oftentimes we get stuck just trying to get the interview done, or we have a checklist of questions that we need to answer. And we forget that just rifling through that almost gives like the Wizard of Oz appearance, where there's a curtain and there's someone operating things behind the scenes, and that can be super invalidating for the client. And it's just so much easier to level that power dynamic by like explaining the process and being human and coming at them from a open perspective and kind of showing your hand, so to speak. And that often diffuses any, at least in my experience, any hesitation that folks may have in engaging.
I think that's terrific. And what I also think about is, which we didn't touch base on, is shame. The power of shame, the sense of shame that people have, even in distress, that somebody called on them and somebody had to respond. But that kind of approach, Jacob, that you described really levels that all out and makes them feel person in distress and that might be feeling shame feels respected and heard. So thank you so much, Jacob.
There's a comment in the chat from, I hope I say this correctly, Arash. I'm curious whether you have any feedback about the best ways to balance accounting for implicit bias while acknowledging that the populations frequently subjected to that the bias are often victims of historical oppression that lead to widespread negative mental health outcomes over time. Is that something you recommend evaluating in an ongoing way, subjecting to dialogue, etc.? Great point.
I can go ahead and hop in on that, and I would encourage Ollie and Josh to chime in as well, and even any one of the participants. So yes, with implicit bias, part of this is going to go back to that self-assessment and the information that we're gathering, where we're gathering our information, but incorporating this into the organization. So we're having the regular conversations about this, and we know the communities that we're serving. So being able to access those pieces of information, like with the data, and then, okay, who are we serving in our county, and what are going to be some things that we need to keep in mind as we're serving them. So keeping that conversation going to where it's critical thinking that's happening within the organization. So it's not just one individual, it's organization wide. So we know how to respond. And when the time allows in those interviews, when in your work with them, you can definitely pursue that. You just have to be strategic about it in terms of, does it actually fit right now? Like, what is the level of distress that we're experiencing? How does it fit? Is this the right time? It might not be, but keeping in mind how you respond, because, I really appreciate the feedback that came from like John and Julia and Jacob and what they've shared, because the other piece to what they're saying is this is going to be reducing the threat. So if thinking about the systems of oppression and what we've experienced, even from law enforcement, the high number of shootings, how you're going to be associated with them when you're working in crisis response. So identifying yourself and sharing that, but keeping in mind, like, how much of a threat am I being towards this individual just by my presence alone? So keeping that discourse within the organization with additional team members, I think, is a great place to start, and understanding who the communities are.
Hi, my name is Bobby, and I'm from Sac County Mental Health. And I just would like to piggyback on, I don't remember who it was, which speaker it was, that commented on respecting the silence when you're with a client. Don't feel rushed or anxious or like something needs to be said to fill the void of silence, because that silence is a crucial moment as well. Thank you.
There's a comment in here from Jacob. I'm going to go ahead and read this. It says, the system has often approached minority treatment from a "we are doing this to you" approach, which is inherently incredibly threatening. The the more we frame our presence as working for the individual accessing crisis services, the better. So I just really want to applaud that, because I think you are absolutely right, Jacob. And when we think about our communities of color and the way treatment has been offered in the past, and remember, we talked about ethical considerations and the challenges to that over history, the testing even that was done on people of color, and in the name of science and improving healthcare services. There's so much for us to take into consideration, but these things have been shared from generation to generation. So how do I trust these systems that have openly harmed us, that have continuously harmed us? So you're absolutely right in this. And part of what Josh had shared earlier is going into the communities, knowing the communities, because if we're going to serve you, we need to know who we're serving. We need to know who you are. And that's really important. So I think your statement highlights that exceptionally well. So thank you, Jacob.
Mm-hmm. Yeah, that's a great example of intersectionality too, Jacob. And the comment that was voiced about silence is incredibly important. There's nothing richer, in my opinion, than silence. And I think that is a really important factor. And we also we didn't talk about it here, but silent messaging and how important, for a Native example, having badges that have a Native look to them. And that's a silent message that you're an ally, even if you're not a Native person, or even if you're 6 feet tall.
Really want to thank each and every one of you for taking time out of your busy schedules. We understand and we acknowledge that you being here means you're not out in the community. So we appreciate you taking time to be here with us today. And I wish you all a wonderful rest of your day.